Welcome back, Lifesavers, to another nursing video. My name is Nurse Kelly Tyrrell, and in today's video, we are going to be covering the most common medication routes and abbreviations that you will need to know as a nurse. Buccal, intrathecal, nil per os, what does it all mean? Well, you are about to find out soon enough, but before we jump into the video, make sure you subscribe to my channel, like, comment, and share this video with a friend, and make sure you click on that bell icon to turn on notifications so you don't miss out on my upcoming content. Okay, so you're a new nurse on the floor when suddenly a doctor yells at you, I need 0.6 mg NTG SLQ5 minutes times 3 stat. Wow, that is a mouthful, literally and metaphorically. Get it? Because nitroglycerin is given sublingual in the mouth. I know, it's just some corny nurse humor for you. But anyway, back to the serious stuff. So it's important to be able to process these emergent orders on